fitting and caring for your therapy mask. Masks that can be used with your therapy device come in various types, shapes and sizes. At Respicare we have a full range of masks and we can advise users on the mask that's most suited to them. But it's worth noting that whatever mask you use must be worn tight enough so that there is no excessive leak from it. Nobody likes having to wear a mask that's too tight, but once the mask is the correct size for you, if it's leaking, then it simply needs to be tighter or possibly repositioned. Wearing a mask tightly may be something that requires a little getting used to, but it's also advisable not to have the mask tighter than it needs to be. So here's a short demonstration on how to fit your mask. There are lots of masks available, but for this demonstration we will use a good standard full face mask. All masks have a cushion, which is the part that rests against your face, a headset or head strap, which is the straps that go around the head to hold the mask in place. These have Velcro ends which can be used to tighten and adjust the straps when needed. Where the bottom straps connect to the mask, there is always a hook or catch. This is so that once your straps have been adjusted appropriately, for taking the mask on or off, you can simply open this catch to release the strap and remove the mask. When the mask is being applied again, this catch can simply be clicked back in. This means that you should not need to open the Velcro on the straps when taking the mask off or putting it back on. Using the catch to remove and reapply the mask will preserve the life and effectiveness of the Velcro, as constant opening and closing of it wears it down quickly. The mask frame is the hard plastic frame of your mask. The swivel connection is the part that connects to your breathing tube. Once this is connected, there is a mask connector that makes it easier to remove the mask from the breathing tube when required. This connector will remain in the breathing tube. If for some reason you need to get a completely new mask, remember to remove this fitting from the end of your breathing tube before inserting a new mask, as you won't be able to connect a new mask if there is a mask connector already there. If you find some holes, like these, built in anywhere on your mask, then as they are built in, they are something that's supposed to be there for various reasons, so make sure you don't block them with anything. To fit the mask, push the head straps out of the way and apply the cushion where it should go comfortably. As this mask is a full face mask, it goes around the nose and mouth. Pull the headset behind and around the head and click the catch of the open bottom strap into place. Once the therapy device has been turned on, run your hands around the sides and top of the mask to see if you can feel any leak getting out from around the sides of the mask cushion. Your mask will always have an exhale port, which is the place where your exhaled breath will leave the mask. On this mask, the exhale port is around the white rubber ring that surrounds the swivel elbow. A Respicare representative will advise you where the exhale port is on your mask. You will always feel a slight breeze of air coming from the exhale port on your mask, and this should be the only leak from the mask that you can feel. If your mask has a forehead support, like this one, ensure that it is comfortably resting against your forehead. It should not be tight enough to leave a permanent mark. However, if your mask is made without a cushioned forehead support like this one, then it's really important that this part of the mask frame is not pushing against the forehead, as there is nothing to prevent the forehead from marking. So in this case, try to ensure that you can easily get a finger between your forehead and the top of the mask frame. If you need to adjust the tightness of this forehead support, open both top straps at the same time. You can adjust both straps until the forehead support is in the appropriate place and is comfortable, and then stick the Velcro again. To adjust the mask for general tightness or to address leakage issues, open both bottom straps at the same time. You can adjust these straps out to make the mask fit slightly looser. However, if this causes the mask to leak, you need to tighten these straps again. If the mask is leaking, with the bottom straps open, pull the straps tighter until the leak has disappeared. Once there is no leak, there is no reason to tighten the straps any further, and you can just stick the Velcro to hold the straps in place. If you find your mask is leaking, you should only really need to tighten the bottom straps. You shouldn't need to tighten the top straps too, as this might cause unnecessary pressure on the upper part of the mask, which can lead to facial marks. Once the mask is tight enough, you should now be able to lie down in any position that is comfortable, but if through turning at night the mask starts to leak, you may need to tighten the bottom straps a little further to correct this. If you prefer to sleep sitting upright or propped up by pillows, ensure that the breathing tube is pulled to one side so that if the head starts to drop forward, the tube will not push against the mask and affect its position. When removing the mask, open the clip or catch that attaches the strap to the mask and then remove it. Always ensure that the clip or catch on your mask has been opened before putting the mask on or removing it. Trying to pull an unopened mask over the head can damage the mask and the straps. If you have any questions in relation to fitting your mask, please contact us at Respicare using the phone number provided on the sticker on your therapy device, and we'll be ready to support you. It's important to keep your mask and headset in good condition. This can be done by being gentle with the cushion and mask in general, and never stretching the cushion or the straps beyond reasonable limits, or connecting parts together without looking at what you're doing. Always use the clip or catch to open the strap for removal of the mask, as constantly opening the Velcro unnecessarily can wear the Velcro down, and stretching the straps over the head rather than opening them will stretch the straps very quickly, meaning that they will need to be replaced in a very short time. You should wipe the mask after each use and disassemble it for a more thorough cleaning on a weekly basis. But bearing in mind that this mask will be going back onto your face quite soon after you've cleaned it, it's important not to use any harsh cleaning materials that would be harsh to the skin on your face. Respicare always recommend to never wash your mask with anything that you wouldn't put on your face. After each use, the easiest thing to do is to wipe the mask cushion with a soft, moistened cloth. For a more thorough cleaning each week, you'll need some warm water, ensuring that the water isn't hot, and you can put it in a bowl or use a sink. You'll also need a clean cloth and some soap, and it's best to use something that's kind to the skin. You'll also need to disassemble your mask. One of our representatives will show you how to do this when you receive your initial demonstration of your mask. You may have a mask where the cushion doesn't come away from the frame at all, or one where the rubber is connected to a hard plastic shell that comes away from the mask entirely. But in most cases, the rubber itself will simply pull away from the mask frame gently. If you mostly use your therapy device at night, it's always best to wash your mask as early in the day as possible, because if certain parts need time to dry, then the earlier you wash the mask, the more drying time is allowed before the next use. First, disconnect the mask from the breathing tube. This is to ensure that any water or soap used will not roll back down into your therapy device. Next, you need to remove the straps and also remove the mask cushion. Put a small amount of the soap you're using into the warm water. Submerge the mask frame in the soapy water and use the cloth to wash all accessible areas. If your cushion comes off the mask frame, ensure that you also clean the edge of the frame where the mask cushion will push back on. Next, you'll need to wash the mask cushion, if it is a separate removable piece. You'd wash this using the same method, but just be very gentle as you might tear or damage it if you're not careful. Once you've washed these parts, you'll need to rinse them under some cool running water. Then you can simply leave them to air dry. But if you're planning on using your mask soon after washing it, it's okay to use a soft, clean towel to dry these parts. You'll then need to push the mask cushion back into place onto the mask frame. To wash your straps, it's possible to use the same soapy water to hand wash them, but it's also possible to put them into a washing machine. If you're planning to wash them in a washing machine, it's best to leave the Velcro stuck in the closed position and put the straps into a pillowcase and use a cool wash cycle to a max of 30 degrees Celsius. When this is done, the straps can be left on a radiator or on a washing line to air dry. When the straps are dry, you'll need to reattach them to the mask. This procedure would be something that one of our representatives would demonstrate to you when they supply your mask. But if you find this difficult, just call RespiCare and one of our staff will be happy to explain this to you. This video is meant as a guide, but if there are issues we can help with, whether they are covered in this video or not, RespiCare staff are available at all times and happy to assist you. You can contact us using the phone number on the sticker on your therapy device.